The facial artery, right? The facial artery, and that runs at the angle of the mandible. It comes there and goes, right? This is the masseter muscle. So this is the facial artery, comes over here and go to the angle of the superior and the inferior eyelid. So that is the canthus, medial canthus area, just goes towards to the side, right? That is the facial artery, right? And you can see here, this is the facial vein, just runs with the facial artery, right? The facial artery, the facial vein, the facial artery and facial vein just goes from here and goes to the angle area of this medial canthus, right? So what other structures we study in our lectures, that the facial muscles, right? As a sheet of muscles, it comes like a sheet, right? And they open an orifices around the area. So here we can have that is the second pharyngeal pouch, right? Second pharyngeal pouch, it's originating, so that's why it's getting the nerve supply, the seventh nerve, the seventh cranial nerve it's supplying. So the muscles around the eye, it is the orbicularis or oculi, right? Orbicularis oculi. So there are three parts there, the orbicularis oculi, we will see details there. So there is the orbital part, right? And this is the palpebral part. In here we have the palpebral part, inferior and superior eyelids. We have the palpebral part and the orbital part. And more medially we have the lacrimal part, right? Lacrimal part we have. And again around the lip, that is the orbicularis oris. Orbicularis oris we have here, right? Orbicularis oris and risorius muscles, you don't see most of the muscles here, right? And the other muscles we should know, this is the masseter muscles. This is the bone here. This is the bone, that is the zygomatic arch, right? The zygomatic arch, right? And from the zygomatic arch we have the masseter muscles, comes down and attached to the angle of the mandible, right? This goes down there. You can see the both sides. That side very open, right? This is the masseter muscle. So we've seen facial artery here, right? Facial artery and the masseter muscles, and this is orbicularis oculi, orbicularis oris. Those are the important things, right? So we will come again in the lectures, we go through again these structures. So we're going to see the parotid gland. I'm going to explain a little bit about the parotid gland, right? And this is the parotid duct, right? So this is the parotid gland. Parotid gland, where it's located, the parotid gland, between the mandible and the mastoid process. On the back we have the mastoid process and the mandible. So the gap between them, so we have the parotid gland. Parotid gland, what is actually? It is a salivary gland, right? Salivary gland, and it is a serous salivary gland, right? It's not a mixed, it's not a mucus, it's produced always serous fluids, serous salivary gland. So submandibular and sublingual are the mixed and submucous, mucus and the serous fluids. So this is the parotid gland.
Is it only on one side?
Both sides, yeah, we have both sides, right? This is one side and the other one is here. We have the other parotid gland here, right? So both sides we have the parotid. This is, I open it, right, to see the within the parotid gland what the structures runs. So we have the right parotid gland here and the left parotid gland here, right? Two parotid glands there. So this parotid gland, it has a superficial part above the mandible and some deep part deeper to the mandible. So this is the mandible wall. So the parotid gland goes like this. This is superficial and this is the deep, like it's covering like a U shape, right, around this mandible. So this is the superficial part, and deeper part goes a little bit deeper to the mandible. So at the anterior border, where from the anterior border, the duct, the parotid duct originating, it runs over the what muscles? This is the masseter muscle. It runs over the masseter muscles, and this is the buccinator muscles here. This is the buccinator muscles, It runs over the masseter and pierces the vaccinator muscles open into the second upper molar teeth, right? The gum, the area, second upper molar teeth area is opening inside. So what is the name of the duct? Not the parotid duct, that is the Stenson duct, right? Is another name for that is a Stenson duct. Stenson duct, that is parotid duct, right? So this parotid gland, it is located there, and it's from the anterior border we have the duct, and how duct runs that masseter over the masseter through the vaccinator open there, right? And what is the content inside within the parotid gland? What do you have? The facial nerve, right? The facial nerve, once it comes there and it forms the 5 branches we already seen. What are they? Temporal, first you can mnemonic. You can remember the mnemonic in this way. Two zebras, right? Two zebras. What is it? Two zebras. I forgot. Two mean the temporal, right? Zebra is zygomatic, and bit my cookies. Two zebras bit my cookies, right? Two zebras. Two mean is a temporal. Zebras is zygomatic. B is a buccal. My is a marginal mandibular. Cookies is a cervical branch, right? Two zebras bit my cookies. So you can easily remember. So that's there's a temporal and the zygomatic, buccal, marginal mandibular, and the cervical, right? Cervical, cookies, cervical. So those branches are there within the parotid gland. That is the superficial part. And deeper to that, what we have, we don't see the nerves, there are small nerves goes. And deeper to that, we have the retromandibular vein. This is the retromandibular vein. And deeper to that, we have the external carotid artery. The branches of the external carotid artery goes there, right? So the nerve is the superficial. Second one is the retromandibular vein. And the most deepest is the external carotid artery and its branches, right? So these 3 structures you will see within the parotid gland, right? So parotid gland, where is located, the anterior border, what runs and where is going, and then what are the structures within the parotid gland? Most superficial one is the nerve, facial nerve. Second one is the retromandibular vein, and third one is the external carotid artery, right? External carotid artery. And then what is the blood supply to this area? Mainly the branches from the external carotid arteries that give small branches to the parotid gland. What is the venous drainage? It goes into the retromandibular vein, right? Most of the drainage goes to the retromandibular vein. And what is the nerve supply? What is the nerve supply?
Facial nerve.
That's wrong, right?
Oh, vagus
facial nerve, nervous supply. Even the facial nerve within the parotid gland, it never supply to the parotid gland because it's a secretomotor nerve, right? It's a parasympathetic and sympathetic innervations, right? Mainly innervate the parotid gland. Sympathetics comes from along the external carotid artery, right? And the parasympathetic come from the posterior auriculotemporal nerve. You will see that auriculotemporal nerve carries the parasympathetic, right, from the otic ganglion. Otic ganglion that supply to the parotid gland. And what comes from the parotid glands to the lymphatic drainage? The lymphatic drainage, it goes to the pre-parotid, right, or mastoid, pre-parotid or mastoid lymph nodes, it goes there, right? So that is the parotid gland. So parotid gland, where is located, right? And you should know what are the structures within the parotid gland, right? That is very important. For example, somebody get a 15-year-old boy, get a laceration to the face, and he damages, goes through the mandibular region, right, or the mastoid region. And what are the structures damaged? The parotid gland. And within the parotid gland, what are the structures you damage? You should know from the superficial to deep, right? Superficial facial nerve. Second is the retromandibular vein, and most external carotid artery, right? So that you should know. And then the other structure you should know here, what is you see here, right? It's not clear here, you see some structures there. This is the superficial temporal artery, right? Superficial temporal artery, that is the terminal, one of the terminal branch of the external carotid artery. You can see the other side also, right? You can see here it runs. So that is why sometimes the people here have a headache, right? Severe headache when they feel that they pulsatile. Feel this headache over there because of the arteritis, and they have the pulsatile there. That is a superficial temporal artery, right? Superficial temporal artery, and it's another branch. This is the branch. This is superficial temporal, and it's given another branch that is a transverse facial artery that goes there, right? Transverse facial artery. So what is this artery? This is the superficial temporal artery. That is the one of the terminal branch of the maxillary and the superficial temporal. That is the terminal branch of the external carotid artery, right? So those are the structures. What are the important structures we can able to see? We see here, right, and we see the balance in the class. So the scalp, I remove it, right? You can see here. This is the scalp. So we can remove the scalp here. So we can see any structures. Usually what we have in the scalp: skin, subcutaneous tissue, right? And then aponeurotic fibers, right? Pericranial aponeurotic fibers. That fibers have the fronto-occipito-frontalis. You see only the small muscles we can hear. Very small muscles here. That is the frontal belly of the occipito-frontalis. You can see clearly the facial muscles here. And then what we have? They are loose areolar connective tissues, and then we have a pericranium, right? That is periosteum. That is the scalp, right? The scalp, right there. So what we're going to do now, we're going to open the skull and see what is going on inside.
Celestine is causing a shadow. Celestine is causing a shadow.
You don't want to see it.
No, it's causing a shadow.
It's causing a shadow.
So somebody need to, you don't have a glove, anybody? So somebody need to go. Open and see. Yeah, now we get it.
Oh God.
So when you open that, right? Open my hand too. Right? So when you open this, you're going to see inside what is this? This is the dura, right? This is the dura mater. So what is this structure now? What is this one? That is the falx cerebrum, right? You see it is come from there, right? So it's come from here, right? You can see it is actually come from the sagittal suture and comes down and separate the right cerebrum from the left cerebrum, right? This is the falx cerebri, right? Falx cerebri, and it divides, goes into the sagittal fissure. This is the sagittal fissure. It goes into that and separate the brain into right and left, right? Right and left, and then it forms the centurium cerebelli. Centurium cerebelli. Cerebelli, yeah. Tentorium cerebelli. This is the falx cerebri, and we have another one here. It goes there down deeper. That is the falx cerebelli, right? Falx cerebelli. So what we're going to do now, we're going to take out this part also, right? That is the cerebellum. Yeah, it's not clear. Right. This is the cerebellum part, right?
Okay.
Cerebellum. So you're going to see the structures inside. What are the structures? Some of the nerves and things, right? I'm going to show you some nerves.
Okay, so midbrain is there, right?
Midbrain is here, right? The midbrain and the pons goes down. So what we need to do, we need to open that. Let me see. Put it down. Hold it.
I had it like this, you know.
Yeah.
It's him who raised it up.
Right, you can see. So what is this optic nerve, right? Optic nerve. So what is this structure now we're going to see? This is the sella turcica, and you see this is the the stalk of this pituitary gland. This is the stalk of the pituitary gland. This is the pituitary gland stalk there. If you open the deeper inside, what do you have? That is the pituitary gland there inside the sella turcica, right? And this is the stalk of the pituitary gland. And then what we have, this is the one, the nerves, all nerves we're going to see one by one, right? Open here, all cranial nerves goes into their foramens.
Elizabeth.
She's been already asking over there.
Have you tried it? I have a certificate.
I believe you do. You do have a certificate in stupidity.
So now, what is that? What did you say? Is stupidity?
Hey,
You can
go.
see it here. So this is the optic nerve, right? This is the optic nerve, and they form the optic chiasma, and then it's continue as an optic tract, right? And then it goes down here and go to the occipital lobe. So that is the optic nerve, and the olfactory bulb is here, right? Olfactory bulb, and then olfactory bulb from here, right? It's continuing there and goes to the temporal ears, temporal lobes, and for the olfactions, right, smelling. And the third nerve we have here, that is the oculomotor nerve. This oculomotor nerve, right, runs to the supraorbital. Where's the other one? Right, the supraorbital fissure, right? Show me that. Oh, don't put it in the inside, right? So this is inside this here, yeah. So that is the area, supraorbital fissure. It goes into the supraorbital fissure. Once it comes here, it goes there. And we have the trochlear nerve, right? So oculomotor, and we have a small nerve, that is the trochlear nerve, right? And one nerve I missed, I don't know, somewhere I couldn't see that. There's an abducer nerve that also goes into the supraorbital fissure. And then what are the other nerves? This is the trigeminal nerve, right? Trigeminal nerve, it has 3 branches, right? One is goes as an ophthalmic, right? This goes here, there's an ophthalmic, right? And then another one goes here as a maxillary foramen rotundum, and the third one goes to the foramen ovale, that is the mandibular nerve. So these all, you can see when you pull, you can move all these 3 branches. One goes there, and another one goes here, another one goes there. 3 branches, just go 3 foramens, right? Foramen superior orbital fissure, foramen rotundum, and foramen ovale, right? So you can see here, right? So this is the, just turn this way, right, to show you. So this is the foramen rotundum, foramen ovale, right? And these 2, and then again here superior orbital ophthalmic nerve, maxillary, and the mandibular nerve. And then we have the 7th nerve, right? 5 and 6 so I don't see it. The 7th nerve, you can see the facial nerve, and what we have facial nerve, and this is the facial nerve and the vestibular cochlear nerve. Small nerve. Yes. Facial and the vestibular cochlear, they run to the internal acoustic meatus. Internal acoustic meatus. You see this opening? The same opening here, internal acoustic meatus. And then we have here, what is this structure? This is the jugular foramen. You can see here lots of nerve, glossopharyngeal, right? Spinal accessory, and the 10 vagus. All 3 runs here, right? So all 3 runs here, 9, 10. You can see here also. That is the internal jugular, the jugular foramen, right? Jugular foramen that runs over there. And you see another one here, this is the hypoglossal nerve. This is the hypoglossal nerve to the hypoglossal canal. Yeah, hypoglossal nerve, right? Hypoglossal canal. So what is this structure in the side? What we have here, this is the cavernous sinus area, right? When you remove that, that is the cavernous sinus, right? You can, when you remove this fascia, the dura, you will see this is the cavernous sinus, and on the lateral wall of the cavernous sinus what we have? Third nerve, then third, fourth, and first and second branch of the trigeminal, and then yeah, those are the one on the lateral wall, right? Abductions usually goes inside the cavernous sinus, right? Cavernous sinus. So these are the structures you need to know. But I'm not going to put anything here like foramen here, but I definitely put a foramen in here, right? You should know each foramen what goes there. But here you should know what is the structure. This is the optic chiasma, optic nerve, right? This is this. Sella turcica is here, right? Crista galli, and this is the cribriform plate, right? Cribriform plate. And the sinuses, where we see the sinuses, you can see here when you open this, right? So here you will see the sinus goes there, right? Yeah, sinus goes there. I show you another. So what I'm going to show you all exact brain, right? So we remove it. I'm going to show you a good brain.
A good brain. Everything on you is bad.
Doctor, where are you getting these good
A
things
good
from?
brain.
From his other
So you are paranoid?
How come you have
I'm
two
already.
All right. So this is
Nice brain.
actually this is the right cerebrum. Oh,
coming.
and this is the left side, right? Right and left cerebrum, right? Cerebrum there, and what we have here? Cerebellum, right? This is cerebrum, and this is cerebellum, and we have here. Oh my God, something going to my. Let me get a glove. Oh, it's burning.
I guess it punches.
So we have here what we have on the cerebrum, right and left cerebrum, and we have here, this is the cerebellum, and you can see this is what, this is the spinal cord, right? This is the spinal cord, and you can see here, can I have the forceps please? And let me show you one by one the structures, right? So the lobes here, so this is the frontal lobe, right? This is the frontal lobe and the frontal pole, right? And this is the occipital pole and occipital lobe. And what we have here, this is the temporal lobe. Yeah, this is the temporal lobe. This is the temporal lobe, and this is the parietal lobe. Sorry, this is the parietal lobe, frontal lobe, parietal lobe, temporal lobe, and occipital lobe. And this is the transverse or the Sylvian fissure, right? Or the transverse sulcus. And we have in the middle somewhere here, this is the central sulcus. This is the central sulcus. And these are called as, what do you call this? These are the gyruses, right? Gyruses and small sulcuses there. So in the middle between them we have, this is the sagittal fissure, right? Sagittal fissure there, sagittal fissure there. So then we have the cerebellum. This is the the spinal cord, and you can see here, sometimes mark it because here the mark there. So what is this? This is the pons. This is a mark somebody. Mark still there. Yeah, that's it.
So you mark it again.
So this is pons, and here we have the midbrain, and this is the medulla, right? This is the medulla. You can see here, this is the pyramid and olive and pyramid in the medulla, right? Pyramid and medulla in the medulla. And then what we have, again we have here, this is the, what do you call, this is the optic chiasma and the optic nerve, and this is the infundibulum of the stalk of this pituitary gland, and this is the hypothalamus. This is the hypothalamus, right? And this is the hypothalamus. So this is what? Olfactory bulb, right? Olfactory bulb. So what are you going to see now again? So what is this? This is the cerebrum and the frontal lobe, temporal lobe, occipital lobe, parietal lobe, right? And here we have here cerebellum. So this is spinal cord and the medulla, pons, and midbrain, right? Midbrain area there. So now the arteries, we're going to see the circle of Willis now, right? So what is this? This is the vertebral artery, right? Two vertebral arteries, right?
Yeah.
And we have, what is this? This is the
Basilar.
basilar artery, right? Somebody can hold it. Oh, sorry.
Go ahead.
Sorry, hold it like this. I need to see also. Right, so you have the basilar artery is dividing into two branches, right? So these are the occipital branches, right? The occipital, give the light. Yeah. The occipital branches, right? Posterior cerebral, sorry, not occipital, posterior cerebral, sorry. Posterior cerebral arteries. The basilar is divided into posterior cerebral, and then it is connected with the.
Nope, I
I think
can't.
it's
Oops,
removed
sorry.
right
I just don't want to block his light, but I want to get it.
Okay, this is the. So you can see, right? This is the actually the branch goes there. This is the anterior cerebral arteries. These are the. This actually I need a. Can I get another one?
What happened?
Oh God, this one is fine.
Internal carotid artery, right? Internal carotid artery, that's from the posterior communicating branch. Actually, it's supposed to come down here, and I think it's removed somewhere. I don't know.
It's much better.
It was a good one, but it's come down. Removed.
So clear.
Wow.
No.
Right, it's connected to the posteriorly to the, with this posterior cerebral. There's a posterior communicating, and this is the anterior cerebral artery. This is the anterior cerebral artery, and these two anterior cerebral arteries are connected by anterior communicating branch. Right? You see here in the middle, we have the anterior communicating branch, right? The anterior communicating branch. So that is there in the anterior communicating branch. So you can see here, so this is one, this is circle of Willis around that midbrain area, right? Midbrain area. So those are the structures you remember. So what is this? This is the vertebral artery, basilar artery. There are some other branches, don't worry too much, right? So this is the vertebral artery, basilar artery, posterior cerebral, and then the anterior cerebral here, right? And another anterior cerebral here. Both are connected by what? Anterior communicating artery. And then here we have the posterior communicating artery. So they have a circle of Willis there, right? Circle of Willis there. That is the part you need to know there. And then what you have in when you open in the cerebrum, right? You can. It's very hot.
It's very hot.
Sorry,
What
can I
we
get
have-
through?
What we have inside the cerebrum, what we have? Ventricles, right? The ventricle, you can see here, this is the ventricle. So this is the lateral ventricle, right? And you see this is the choroid plexus. This is the choroid plexus and the lateral ventricle. So you can cut and see this also. If you cut it down here like this, right? The brain, and you can see the ventricle. It's not here. You see here, so this is the lateral ventricle, and what do you see inside the lateral ventricle? These all are the choroid plexuses goes inside and they form the cerebrospinal fluid, right? This is the lateral ventricle. So lateral ventricle inside both sides, right? And you see when you open this into half, what do you see? This is the corpus callosum. This is the corpus callosum, and is again, you see that is the lateral ventricle that's communicating here. You see, it's communicating there, right? So when you study your neuroanatomy, you can come and see also if you want, right? It should be there anytime. It's more irritating.
Are we good?
Yeah.
Oh, thank